This is David Viniker, consultant obstetrician and gynecologist and author of twowomenshealth.com. Welcome to this video. I regularly receive correspondence on interesting topics that would suggest to me that a video might be helpful for explanation. My first video in this series looks at a condition called Mittelschmertz. Mittelschmertz is German and it means middle pain. The condition is characterized by lower abdominal pain or pelvic pain, and it occurs approximately in the middle of the menstrual cycle, hence its name. The condition is associated with ovulation or egg release. The majority of women have a menstrual cycle of around 28 days, and as ovulation occurs 14 days before the onset of the next period, the pain tends to be in the middle of the cycle, provided it is around 28 days. Some women, however, are ovulating but have a 21-day cycle, and therefore their pain would occur approximately on the 7th or 8th day of the cycle, and others may have a longer cycle up to 35 days, and they would have the pain at approximately the 21st day. You will be able to read more on this subject by going to my website and looking at the left-sided navigation, and under pelvic pain you will see Mittelschmertz. Mittelschmertz is probably one of the most common of gynecological conditions. It's experienced by the majority of women at some time in their lives. It is usually a minor problem. In March 2010, I received an email from a lady who suffered for many years with Mittelschmertz, and her story is about as severe a problem of Mittelschmertz that I have ever heard. Her story suggested this video. Her email appears in my latest blog, which will become blog 16. I have her consent to publish her email, although for professional reasons I always make sure that such correspondence is anonymized. This lady suffered with severe problems for the best part of 30 years. She had severe pain with vomiting for 3 days, was unable to eat or sleep. She left her bed to allow her husband to rest. She could not complete a degree course. She found regular work impossible. She never conceived, probably because the pain was such that she could not have intercourse around the time of ovulation. She went to doctors who told her that it was just one of those things. On several occasions she spent time in hospital where the differential diagnosis was thought to be appendicitis. She found painkillers useless. The pill was wonderful, but then she developed a deep venous thrombosis and the pill was then contraindicated. In the end, she counted down the months to her menopause. Around the time of ovulation, there are a series of natural events, and we are not absolutely certain which one, or perhaps combination, are the cause of the Mittelschmertz pain. Just before egg release, the egg is developing in a small cyst. A cyst is a small sac containing fluid. The follicle swells, and this may be causing some of the pain. The cyst ruptures and then releases a little blood and fluid, and this may cause irritation. The lining of the abdomen is called the peritoneum, and when the peritoneum is irritated, it causes pain, and we call that condition peritonism. Finally, at around the time of ovulation, the fallopian tubes contract more vigorously, presumably as they're trying to pick up the released egg and then begin to waft it down towards the uterus. Clinical management depends initially on diagnosis. The story of a regularly occurring lower abdominal pain around the time of ovulation is the key to the diagnosis. Most gynecologists would probably arrange for a pelvic ultrasound, but the story is usually diagnostic. I would emphasize that if a lady with Mittelschmertz has an alteration 1 month in her symptoms, then other diagnoses must be considered and further medical review is required. I've seen several ladies who have had Mittelschmertz, but then there is a change in the story, and even though she may have had a bleed around the time of her expected last period, the period was abnormal and the pain has proven to be an ectopic pregnancy. Assuming that the story suggests Mittelschmertz, then the first thing to do is to provide reassurance, to explain that the condition is common, most women have it, and if the problem isn't severe, then treatment may not be required. If treatment is indicated, then the first line may be analgesics. Paracetamols may suffice. In more severe situations, we have to prevent ovulation suppression. The condition is dependent on egg release, and clearly by suppressing egg release, the pain should vanish. The usual way to stop egg release is to use the combined oral contraceptive pill. This is successful for the majority of women. The lady with the story of severe Mittelschmertz, whose email suggested this topic for a video discussion, had her pain successfully treated by the combined oral contraceptive pill. But she then went on to have a deep venous thrombosis, a clot in her leg, and the deep venous thrombosis would mean that the combined pill was from there on in contraindicated. I would have thought that these days such an unusual combination might lead us to consider suppressing egg release by the use of GnRH. I'll describe GnRH in a later video, but you can look at this topic on my website. This is David Viniker of twowomenshealth.com. I hope you found this video interesting. Thank you for watching.